Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be discussing the cavernous sinus thrombosis from the chapter of odontogenic infection. So cavernous sinus thrombosis is a very much important topic that is frequently asked in your examination or it could be asked by the examiner in your vivas as well. So you need to understand it very well. Before moving on towards the topic, we first need to know about the anatomy of cavernous sinus. We have posted a video on the anatomy of cavernous sinus, so you should refer on to that video in order to understand the anatomy, the communications, the relations, the contents and boundaries of cavernous sinus in order to understand the cavernous sinus thrombosis very well. So you should first watch the anatomy video and after that you should watch this video. In this video, we will have a brief recap of the anatomy as well. So cavernous sinus is basically a paired dural venous sinuses. As we know that we have the dural venous sinuses, which means that these are the venous sinuses containing the venous blood and it is present between the dura mater, that is the dura mater layers of the meninges. So we have the other dural venous sinuses as well, and cavernous sinus is one of those dural venous sinuses. Another important point about the cavernous sinus is that it is a valveless, which means that blood in the cavernous sinus, that is basically your venous blood, could flow in either of the direction with equal possibility in the any direction. As far the location of cavernous sinus is concerned, it is present in the middle cranial fossa in the body of the sphenoid. So let us have a brief intro and recall of the contents that were present in the cavernous sinus. So we have the mnemonic of tomcat as well to remember the contents. Those were basically the important structures that were either present in the lateral wall or that were passing through the middle of the sinus. So in the lateral wall, we have the trochlear nerve, the oculomotor nerve, the ophthalmic nerve, the maxillary division of the trigeminal nerve, and as we move on towards the medial aspect, we have the internal carotid artery that is passing from the middle of the cavernous sinus, and we have the abducens nerve. So these were the important structure or the content that were present in the cavernous sinus. So now you have insight about them. So any infection that could involve your cavernous sinus would have the equal chances of damaging these structures. So let us move on towards the etiology of the cavernous sinus thrombosis. First, you need to understand that cavernous sinus thrombosis could be either septic one, which means that it does have the infectious origin, or it could be the aseptic cavernous sinus thrombosis that means that there was no prior infection present. It is just of the inflammatory origin. So, for the septic cavernous sinus, it could be due to the following conditions, that was the sinusitis, basically your sphenoidal sinusitis or the ethmoidal sinusitis. As again, you need to know about the anatomy that we do have the ethmoidal or sphenoidal sinuses present in proximity of the cavernous sinus. So any of this infection of these sinuses, they would directly lead to the septic cavernous sinus thrombosis. Another important cause could be the facial furuncles that would be formed, or any bacterial infection that could be formed in the area of your danger area of the face. Any erysipelas in these region. The other important etiological factor could be the otitis, that is the middle ear infection, or it could be most importantly the odontogenic infection, that means that any infection arising in the any of the tooth, but that should be means cavernous sinus proximity, most probably towards the canine region, or it could have the canine space infection that has most probable chances of involving your cavernous sinus and leading towards its thrombosis. So this was the etiology of the septic cavernous sinus thrombosis. Now we will move on towards the aseptic type. In the aseptic type, it could be due to two reasons. Either any surgery was done and you have iatrogenically involve the cavernous sinus, and these surgeries could be the nasal surgeries, the turbinectomies, the nasal septum deviational surgeries, or any sinusitis surgeries, which means that any surgery that was done for drainage of any sinus infection or any kind of other surgery that was performed to involve the sinuses that could iatrogenically involve the cavernous sinus and leads to the thrombosis. And second important reason for aseptic cavernous sinus thrombosis could be the trauma, any direct impact or indirect impact, any fracture, any trauma that has involved your cavernous sinus could be a cause of the aseptic cavernous sinus thrombosis. So this was about the etiology. Now let us move on towards the pathophysiology of the cavernous sinus thrombosis. So pathophysiology is of the septic one and the aseptic one again. As we know, in the septic type, we have the infection. So any bacterial infection was present out there. So at that region, the bacteria will promote the thrombosis by following procoagulation substances, the tissue damage toxins that were the endo or the exotoxins that could damage your tissue and lead to the thrombosis. And as far the aseptic cavernous sinus thrombosis was concerned, the pathophysiology for that is very much simple, that any iatrogenic damage or trauma would directly lead to the inflammation of the blood vessel, and that will promote the thrombosis over there, which means that it will promote the formation of thrombus and it will lead to the cavernous sinus thrombosis. So this was about the pathophysiology. Now let us study the spread of infectious route. As far we are studying it in the odontogenic infection, so for us the most important cause will be the odontogenic infection. For example, if the any of the canine it is involved and the infection has involved your canine space, so after that we will be studying that how canine space infection would lead to the cavernous sinus thrombosis and how any other spatial infection in the posterior region of your face or in the posterior region, a posterior odontogenic region could lead on towards the cavernous sinus thrombosis. So basically, there must be some pathways or connections between these things that will be leading towards their involvement. So we will be studying that connections and pathway in the spread of infectious route. So first of all, let us study the interior route. So for the interior, you first need to know about the facial vein. We will be posting a video in the head and neck anatomy of the venous supply of the face. You must watch out that video about the facial vein. You should know about the facial vein, coast, its tributaries, its branches, and how does it passes. So it will lead you to have a better understanding of the venous supply of the face and how it is connected with your cavernous sinus. So, for example, in the anterior region, the facial vein was affected via the canines. Any odontogenic infection in that region, it could be the canine region or any other region that has involved your facial vein. So, infection from the facial vein will go on with the angular vein. Angular vein would directly connect it with to the cavernous sinus through the superior ophthalmic vein. So the infection from the angular vein, that is the it will be passed on towards the superior ophthalmic vein and superior ophthalmic vein. It will directly connect and involve the cavernous sinus and will lead to the thrombosis. So anteriorly, as you can see in the diagram as well, we have shown it through a path. First of all, that is the facial vein, and after that, as facial vein move upward, it becomes angular vein, that is at the medial corner of the eye, and that angular vein directly connected with the superior ophthalmic vein, which was directly connected with the cavernous sinus. So this was your anterior pathway. After that, we does have a posterior route as well. In that case, pterygoid venous plexus that is present in the posterior maxillar region. Any odontogenic infection from posterior maxillary teeth will directly go and involve the venous drainage will goes to the pterygoid plexus, and there the infection will spread out through the imagery vein that were also valveless, three or four imagery veins, and these imagery vein that were connected directly to the cavernous sinus will lead towards the infection spread towards the cavernous sinus and in turn will cause the thrombosis over there. So we have two routes. One was the anterior route and the other was the posterior routes. And the main pathway involving facial vein in the anterior one and the pterygoid venous plexus in the posterior route. So this diagram will also help you to understand and remember the pathway very well. So let us now discuss some clinical features. Clinical features will basically involve the eye signs, the septic signs, and the CNS signs. These signs they will appear due to the involvement of the structures and the contents. Remember that we have studied in the start of the video. Eye signs will basically be the proptosis, chemosis, periorbital edema, painful globular movement, and headache. But headache it will be unilateral and in the frontotemporal or retrobulbar region. Initially, these signs will be due to the venous congestion, and then after that, it would be due to the paralysis of the third, fourth, and sixth cranial nerve that was present in the cavernous sinus. Now, let us move on towards the septic signs. That is due to the infection in the septic cavernous sinus thrombosis, will have the toxic appearance and you'll have a picket fence fever, which means that sudden rise of temperature, then it comes down, then it again sudden rise of temperature, and then it come down. So you'll have a picket fence fever present, chills, tachycardia, and hypotension. After that, we will move on towards the CNS signs. As we know that this sinus was present in the meninges, and that was the dura mater, the endosteal layer of dura mater. So any infection out there have equal chances to spread and involve the other regions of the brains, the meninges as well. In advanced cases, it will involve the meninges, which leads to the meningitis. And in the meningitis, we need to know about the two important signs. First is the Kernick signs, that is that if flexion of the hips at 90-degree and then you tend to straighten the knee, it will cause the resistance and pain. So this is known as the Kernick signs. Then you have the another signs known as the Brzezinski signs. In that the stiffness of the neck it will cause the patient hip and knee to flex when you will try to flex the neck. So basically the neck was stiff and you're trying to flex the neck, but instead of that the patient hip and the knee it will start to flex. So this was the Brudzinski signs. In advanced cases the patient can go into the coma and it could lead to the death as well. So these were the important clinical features of cavernous sinus thrombosis, again frequently asked. Now let us move on towards the diagnosis of cavernous sinus. So for the diagnostic, important criteria is given that is known as your Eagleton's criteria, and it is again frequently asked in different questions. So you need to know about the Eagleton's criteria. They are basically the six factors. So if you have studied those clinical features in detail and you have understand it very well, so this in order to remember this criteria, that will help you a lot. So first of all, the first factor or criteria for the cavernous sinus thrombosis is that there should be known site of infection. Secondly, there should be septicemia. Thirdly, signs of venous congestion. After that, you should have paralysis of the third, fourth, and sixth cranial nerve. The neighboring soft tissue abscesses should be present out there. And last criteria is that meningeal irritation, and that was your CNS signs. So this was the Eagleton's criteria. Now let us go on towards the management of cavernous sinus thrombosis. So first of all, the patient has come, is presented with those clinical features, and you have examined the patient, you have taken the histories as well, you are seeing the signs and symptoms, and it was also mm, fulfilling the Galton's criteria. So that patient, first of all, you need to go directly with the high dose empirical antibiotics, that is the third generation cephalosporin or metronidazole by the IV route. And meanwhile, you should confirm the diagnosis also by the CT scan and MRI. So one important thing to be noted in the CT scan and MRI is that a CT scan and MRI will reveal the convex lateral wall of the cavernous sinus. which is usually due to the formation of thrombus, because originally the wall was concave, but due to the thrombus formation it appears to be convex. So it is a very peculiar representation of the cavernous sinus thrombosis. Secondly, radio-opaque bubble in the cavernous sinus will be also present, and that will be directly showing you some thrombus formation. Culture and sensitivity, if that would be performed, it will reveal the Staph aureus colonizal culture. So now you have confirmed the diagnosis through the CT scan and MRI as well. So after that, what will be the protocol or sequelae? So for the septic cavernous sinus, you need to first give the antibiotic therapy that was also given initially in the empirical form. Now you will continue on with that. Third generation cephalosporin, vancomycin, or metronidazole for 3 to 4 weeks. Then you will go for incision and drainage of the primary infectious site, as it is the septic one. So any infectious site that was present, you need to do the incision and drainage out there. After that, another option is go of the IV unfractionated heparin. But in case of unfractionated heparin, you need to be very cautious about that. If there is any presence of intracranial bleeding, then you will not give the unfractionated heparin because it could exacerbate that condition. So it is contraindicated in that case. After that, you will go for the steroid therapy. In that, you will go for the corticosteroid dexamethasone, and this is usually given because these will reduce the edema of the eye. You remember that we have the periorbital edema, chemosis, any kind of edema or arterial venous supply, it will be reduced by taking your dexamethasone therapy. After that, you will give the mannitol. Mannitol is usually given to the patient because it reduces the intracranial pressure, and that will result to prevent the blindness. That was a late sequelae of the cavernous sinus thrombosis. So now, basically, the antibiotic of choice is the chloramphenicol 1 gram per 6 hourly. So now we will move on towards the aseptic cavernous sinus. All of the measure that will be similar except for the there should be no antibiotics because it is not of the infectious origin, and no incision or drainage because as it is the aseptic one, so there will be no infectious site present. After that, the rest is same. You will go for the corticosteroid therapy, dexamethasone for reduction of the edema, IV unfractionated heparin because it's a thrombus, so you need to dislodge it. But again, you need to be cautious in the regard of the if any intracranial bleeding, so it is contraindicated in that regard. Then the mannitol that was given to reduce the intracranial pressure to reduce the blindness as well, and in order to prevent the blindness. And after that, you can also give the some thrombolytics as well, in that you could give the streptokinase. So this was the for aseptic one. Now, we could have some surgical intervention as well for the cavernous sinus thrombosis, and that involve surgical drainage of the affected sinus, endoscopic sinus surgery, or surgical debridement in the fungal sinusitis. So this was all about the management of cavernous sinus thrombosis. That if the patient comes, then how you are going to manage that patient. So, this was all about the cavernous sinus thrombosis. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.